Hi, everybody. Thank you for joining us for today's webinar on a Critical Access Hospital's Guide to Outpatient Pharmacy Opportunities. Let's get started here with what are the opportunities for critical access hospitals. Firstly, one of the main reasons that critical access hospitals venture into the outpatient pharmacy world is because of the new revenue and profits that are generated by filling outpatient and specialty prescriptions at 340B prices. Secondly, because of savings that they're able to realize on drugs that are used within the facility, particularly if you have an infusion center. Thirdly, because of reduced employee benefit expenses via both 340B and GPO pricing. One of the great benefits of critical access hospitals is the dual discount that you're able to access. So if you have an employee that is not 340B eligible, you are still able to pass on GPO discounts to them through your employee benefit plan. You have additional community services that 340B profits can help you provide. And, of course, free or discount pricing on drugs for the uninsured or underinsured patients within your system. It's important to start the outpatient pharmacy strategy with an understanding of the size of the revenue, profit, and savings potentials that you have. These are dependent upon several factors. Firstly, you have the number of eligible 340B physicians within your network. So again, the more physicians you have that are 340B eligible, the higher the revenue and profit potential of your 340B program. Then you have your ED and discharge volume. Again, the number of people that is seen within your facility or any of your 340B eligible facilities will really help drive the overall script volume that your hospital system is able to see. The size of your community, of course. The bigger communities, more likely, the more patients you have. Therefore, the more number of scripts you're able to generate. The number of contract pharmacy relationships you have. So having contract pharmacy relationships is a great benefit, and you're able to have multiple pharmacy relationships. This means that if you don't have an outpatient pharmacy on site, you are still able to benefit from the 340B program by having your patients pick up scripts at some of the contract pharmacies that you have within your community. The number of employees that you have, this is where savings kick in. Again, the greater the number of employees that you're able to qualify as 340B eligible, the higher the prescription drug plan savings you're able to realize. And again, for those that aren't 340B eligible, it isn't an automatic thing for employees. You can still help realize the GPO savings by having them use your hospital pharmacy for their prescriptions. And finally, all of this leads to the number of prescriptions that you're able to dispense either on site through your outpatient pharmacy, which is typically the most profitable, or through contract pharmacy relationships. The pharmacy opportunity extends beyond revenue and profits, and one of the big benefits is patient care. It's a wide known fact that about 1/3 of new prescriptions written for patients go unfilled. And out of the third that go unfilled, you still have about half of those that are actually refilled as prescribed. Patients with high copays, therefore, more inability to afford their medications, recent hospitalizations, and ED visits are the least likely to fill medications. These last 2 points all help increase readmissions. If you don't have patients take their medication or fill their medication, the risk of readmissions increases drastically. One of the programs that are often put in place are a meds-to-beds program. This is helping your patients get their medications before they leave the hospital. This can be through inpatient discharges, your ambulatory surgical center, or your ED. It's been proven that a discharge program that includes counseling and medication delivery at discharge can result in a 45% or more reduction in readmissions or post-discharge ED visits. Now, this is an average number. Some hospitals we have worked with have seen 6-fold decreases inpatient readmissions purely from a meds-to-beds type program. Talking now about a recent project, Jefferson Healthcare, a small town just outside of Seattle, a 2-hour ferry ride to get there, a beautiful place. We worked with them about a year ago to analyze the overall opportunity. This is the potential revenue from all of the opportunity sets that the hospital works within. $1.2 million currently being realized from contract pharmacy relationships. So overall revenue of about $3.4 million. Excluding the $1.2 million that's existing, it's about a $2.2 million in incremental revenue. Bedside delivery. Now, critical access hospitals only have 25 beds. So this isn't an enormous opportunity, but if you throw in your ED and your ambulatory surgical centers, it can be a somewhat significant number. ED discharges, a very profitable opportunity, particularly for critical access hospitals, because you tend to be smaller hospitals and it's not difficult for patients who are seen in your ED to access an outpatient pharmacy or at least one of the contract pharmacies that you have in town. Employee benefit savings, these are either achieved by encouraging your employees to see 340B eligible doctors for their care or passing along GPA savings when that's not the case. Specialty pharmacy opportunity for this hospital was quite significant, mostly because of their infusion center, where they see several patients per day. However, if your hospital has access and 340B eligible prescribers in the areas of rheumatology, cardiology, dermatology, allergy, and gastroenterology, and of course oncology, then you would likely be able to access a fairly significant level of profit from specialty pharmacy type medications. Small increase was seen in gift shop and cafe sales purely by locating the pharmacy in an area that was more retail oriented. We'd find that people, while they were waiting for their script, would grab a cup of coffee or browse the gift shop. Another area this hospital has that was really able to benefit from pharmacy, both specialty pharmacy and outpatient pharmacy, was hospice. Some of these patients are on up to 9 medications per month. They're regularly changed, and having the hospice nurses deliver it to them from the outpatient pharmacy was a great service, but also a nice profit driver for the hospital. This outpatient physicians were incremental benefits that were being seen by outpatient physicians that were within the critical access hospitals network, both 340B and non-340B, but the majority of them at this hospital were 340B eligible, and this is in incremental sales from the existing contract pharmacy. So, of $3.4 million in initial revenue, total EBITDA was $1.5 million. However, excluding the $1.2 million that they're already seeing, they were able to achieve almost $750,000 in incremental EBITDA and an ROI of 64%. Patient satisfaction improvements were another big area for this hospital. Hospitals on average will show about a 26% increase in relative HCAHPS scores after an outpatient pharmacy is implemented, especially when you involve a bedside delivery component. University of Cincinnati Medical Center saw HCAHPS improvements almost double in the scores that asked patients if they were explained about their medication, and their understanding of discharge information increased by 10%. Jefferson Hospital struggled with some of their scores as far as HCAHPS goes when the pharmacy is involved. As you can see here, they were well below the state and national average for staff always explaining about medications before giving it to them. Having a program where pharmacists talk to the patient or deliver the medication to the patient before they leave has really helped improve these scores, and they're now well above the state and national averages. Further on patient care improvements and the Meds to Beds program here, about $780,000 in yearly cost savings over 124 patients in a pilot project, with cost of care projected to fall about $2,500 per patient due to reduced readmissions and fewer ED visits. A lot of this is purely because of improved patient medication compliance. Patients are not needing to go to their pharmacy when they leave the hospital or the ED. They have their medication in hand, either delivered to them or picked up at the outpatient pharmacy on site. One of the other benefits, particularly when specialty drugs is involved, is having your patients understand these complex type delivery systems and how to best use them so they don't interact with other medications, and to make sure they understand when and where and how to take their medications. Again, in a value-based care world, this is vitally important. Employee prescriptions is often one of the big areas you can save in critical access hospitals by incentivizing your employees to become 340B eligible via seeing on-site physicians or in-network physicians that are 340B eligible, and ensuring they are the ones who care for your patients. If you think about this rule of thumb, for every employee, about $1,000 is spent on pharmacy benefits. Having those employees become 340B eligible could help reduce those costs by about 50%. However, for those that aren't 340B eligible, being able to pass along a 10 to 20% discount through the GPO discount program is another way for you to realize, and employees to realize, prescription drug benefit plan savings. This box over here talks about what Scripps has done, a big hospital system in Southern California, and how they target their employees and dependents with those high-cost specialty medications, bringing them inside, incentivizing them to use 340B eligible physicians, or in their case, they use a medication therapy management pharmacist to manage the patient's care, and have saved a significant amount on their benefit plans. And they pass along some of those savings to the employees by not making them pay any kind of copay. So as you plan for this year, please feel free to schedule a call with us, a brief discussion, and we can really quickly help you identify if there's something that your hospital pharmacy or your hospital is missing in regards to pharmacy, whether it be contract pharmacy relationships, outpatient pharmacy, or specialty pharmacy. Really help you identify any untapped opportunities you might have, and can advise you on how to best implement them. The hospitals in the bottom of the page here are some of the recent ones we've worked with. I'd be happy to pass along their names and numbers if you would like to talk more about us or our services to them. My number's there, as is my email address. Please feel free to reach out at any time. And thank you for joining us today. We hope you enjoyed the presentation.